Hello, everyone. Dr. Wright here. Today, we're going to discuss one of the most crucial aspects of social work practice, safety and risk assessments. Whether we're working with individuals, families, or communities, understanding how to assess for potential risks, including violence and intimate partner violence, is essential. These assessments not only guide our interventions, but also ensure that we're doing everything we can to protect our clients and those around them. Let's dive into how we can effectively carry out these assessments with a focus on cultural sensitivity and thoroughness. To start, let's go over the key components of a general safety and risk assessment. This process involves identifying potential risks to the client or others, evaluating the severity of the risks, and determining the best course of action to mitigate them. It's important to ask specific, open-ended questions that allow the client to share their concerns and fears. For example, questions like, are there any situations or people that make you feel unsafe? Or, have there been any recent changes in your environment that concern you? Can open the door to critical information being received. It also is vital to consider environmental factors such as housing stability, community violence, or access to resources, which can all contribute to a client's overall safety. Next, let's focus on violence risk assessments. This type of assessment aims to identify individuals who may pose a risk of violence to themselves or others. Some key indicators include a history of violent behavior, substance use, significant life stressors, and mental health issues such as untreated psychosis or severe depression. There are various tools available to assist with this assessment, such as the HCR 20 or the Danger Assessment Tool. It is crucial to use these tools in combination with clinical judgment and always keeping in mind that each client's situation is unique. Now, let's discuss intimate partner violence, IPV. IPV is a serious issue that requires immediate and thorough assessment. Risk factors can include a past history of abuse, substance abuse, controlling behaviors, and isolation from support systems. When assessing for IPV, it's important to create a safe and confidential environment where the client feels comfortable disclosing their experiences. You might ask questions like, has your partner ever made you feel afraid? Or do you feel safe at home? It's crucial to be aware of the impact that cultural norms and stigma may have on the client's willingness to report IPV. For example, in some cultures, there may be a significant pressure to keep family matters private, or there may be a significant attached to the seeking for help for abuse, a stigma attached to that, which we should be aware of and mindful of. Being sensitive to these factors can help you build trust, which is what we want to do, and encourage honest communication. When conducting any form of risk assessment, it is vital to consider the client's cultural background. Cultural norms can significantly influence how clients perceive and report risks. Partially, when it comes to violence, in some cultures, there may be a strong stigma against acknowledging issues like intimate partner violence, or there may be a difference in interpretations of what constitutes for abuse. As social workers, we must approach these conversations with cultural humility, showing respect for the client's beliefs while also ensuring their safety. And this might mean adapting your language or framing questions in a way that aligns with the client's cultural views. Let's look at a practical example. Imagine you're working with a client from a cultural background where discussing family matters with outsiders is deeply discouraged. And you suspect that there might be intimate partner violence occurring, but the client is hesitant to talk about it. And in this situation, you might start by building rapport and trust, perhaps by acknowledging the importance of family privacy in their culture. You could say, I understand that in your culture, family issues are often kept private, and I respect that. My goal is to support you in any way that feels comfortable for you. Then gently introduce the topic of safety, perhaps by asking, in your experience, have there been moments where you felt unsafe, either at home or elsewhere? By approaching the assessment with cultural sensitivity, you are more likely to gather the information needed to ensure the client's safety while respecting their cultural context. In summary, conducting thorough and culturally informed safety and risk assessments is essential in social work practice. Whether you're assessing general risk, potential violence, or intimate partner violence, it is crucial to approach each situation with a combination of empathy, clinical skills, and cultural awareness. These assessments not only protect our clients, but also help us create more effective, individualized intervention plans. I encourage you all to reflect on how you integrate these principles into your practice to better serve your clients.